Imagine. Imagine you're a 12-year-old girl getting ready for your last week of school. Imagine the day before you start menstruating for the first time. You have to go to school because of the exams, but you really don't want to go. You cobble together what most people use, rags. You're too embarrassed to talk to anyone about it, even your sister. There aren't any pads in the house. Mom wouldn't likely feel comfortable asking Dad for money to buy the pads. You don't have money to buy the pads yourself, and even if you did, on your way to school, would any kiosk even carry them? You go to school and go about your day, but you're self-conscious, and you don't raise your hand the entire day. You don't want to draw attention to yourself. You don't go outside and play. You don't go to the bathroom. There are no girls' bathrooms. And then the teacher calls on you, that dreaded moment. He wants you to do a math problem at the board. You've been sitting in the same chair for 4 hours. You've been dodging the teacher's eyes, dodging this dreaded moment. He insists. You go to the board and you start writing the math problem. And suddenly, blood runs down your leg. Laughter, embarrassment, shame. Would you go to school tomorrow? Millions of girls and women around the world lack access to affordable menstrual pads. This has significant costs not only to her, but also to her community. In terms of education, for example, girls can miss up to 45 days of school every year. Productivity, women can miss work for the very same reason. That's losing income for her and also her family. And health. The common thing is to use rags, and without clean water, this has health consequences. And most importantly, this has a significant cost to one's dignity. Now, I found out about this in graduate school while working for the World Bank in Mozambique, and I was shocked. And then I was outraged. I had learned more about the world and myself in that short time than that really expensive business school degree. So what did I do about it? I started Sustainable Health Enterprises, which is a social venture that invests in people and ideas that are typically overlooked, but can actually have a positive multiplier effect. And our first big initiative is called She28, to solve this problem exactly. And our mission is that no female should have to use a rag. Our first goal is to reach half of the girls in Rwanda, our first country of operation, ages 10 to 14. Now, why 10 to 14? Well, that's the onset of menarche, and that's where girls start their habits. Now, you must be thinking to yourself, gosh, this is such an easy thing to solve. Why don't you just call a company like P&D and ask them to donate some pads? That would be great. Well, actually, this happened. It happened in about a handful of villages in Africa, and it didn't work, unfortunately. There are a couple of reasons why it didn't work. Number one, when the pads were delivered, there was a lack of information and knowledge about health and hygiene. I mean, no one wants to talk about it anyway, right? This is taboo. My dad says I work in healthcare. Secondly, the pads didn't necessarily get to all the girls. Like I said, it was just in a few select places. It didn't get to all the girls in need. And lastly, you can probably already tell. After 6 months, what happened? Went back to how it was before. It didn't last. So what we did was come up with a holistic solution. And this is really our blueprint, something that we hope we have global aspirations to take around the world. And what we do is instigate 3 things: education, advocacy, distribution, and manufacturing. And I'm going to walk you through a little bit of our journey so far. The first thing that we did was start off with education and advocacy in Rwanda. And we brought together the best practices of hygiene curriculums around the world. And we put it together, and we worked with community health workers who reached over 5,000 girls and women with this content. We then had kicked off an advocacy campaign. You see it here. This is in Rwanda. This is the Breaking the Silence on Menstruation campaign. It was a march across Kigali. You can imagine we stopped traffic. This says, there are menstrual obstacles to girls' education. What are you going to do about it? Speak out. And as a result, there were commitments, for example, the Ministry of Health and the Ministry of Education has agreed to adopt the content that we have in our curriculums so that it will reach all nurses and all teachers in the country, eventually reaching all 10 million people. At the same time, the World Health Organization and WaterAid has come up with some global guidelines around menstrual hygiene, and we contributed to that as well. Distribution. In order to tackle that, we did experiments. We did experiments with creative channels, like community health workers. Like I said, they work peer-to-peer in communities. We work through youth centers, and we also work through schools. And we increased access to more affordable pads for over 5,000 girls and women through these experiments. And lastly, we partnered up with MIT, the Kigali Institute of Science and Technology, North Carolina State, to create our own pad, which we call the Launch Pad, launching girls and women into great health and wealth, using local materials, agro-waste actually, in this case, banana fibers, which can be made into absorbent material and with the help of local entrepreneurs, manufactured in a small scale, which we've already done, and now actually in pilot industrial scale, which we've done and are transferring from our partners to the Kigali Institute of Science and Technology right now. Now I'm sure you're curious, how does this all happen? You too can do it with a blender at home. I've done it, actually. First of all, I want to point out what people use typically. On the bottom right-hand corner are rags. Now, while they may be affordable, they aren't necessarily the most effective thing, nor the healthiest. There's another option up there. There's a multinational company that has a product out there. This is actually more than a day's worth of wages, and although effective, out of the reach for most people. And then in the middle there's an international generic import, and we've gone head-to-head with that pad, and the majority in our survey preferred ours, the Launch Pad. Now, I'm going to tell you a little bit about how we make this. We work with local banana farmers, actually 2 main co-ops, which we just created large partnerships with, have 600 small acre farmers, who are typically women and don't typically make an income. So this actually, we procure the fibers. I know it kind of looks like a wig. They extract them from the trunk of the tree. We then process them using a pretty simple machine, less than $10,000. And once it's processed with actually no chemicals, and this is a breakthrough which we filed a patent for in the United States and a few other countries to make this absorbent material. That material is then sent to our local entrepreneurs, women, who assemble the pads using a simple manual/automated assembly machine. And we sell those through we'll be selling those through channels of the government and then retail. Now, as I said, we're starting off in Rwanda. It's really a country in the heart of Africa. It's a very fast-paced, moving country these days. It's growing at about 10% per year in GDP. We think it's a great place to start. It has a business environment. There's approximately a total market of 5 million menstruating females. Like I said before, we're very, very targeted at this 10 to 14-year-old girl, and we believe we can reach half of them by 2017. And again, as you can imagine, this is a global problem. It is a huge market, not only in East Africa, but in Asia, the rest of Africa, the Caribbean, and beyond. We believe that the manufacturing part of our model can be profitable and can be scalable. As you see here from the red line, gross revenue, and the difference between that and the cost. It's a great model in the sense that cost of goods are low, and that cost of goods actually includes a small royalty back to our mothership organization. We have a small CapEx as well. Now, who's gonna take this on? What crazy people are gonna do this? Well, I partnered up with Julian Kayabanda, who is our COO in Rwanda. She is Rwandese. She left her country before the genocide. She has come back to rebuild. She is just a phenomenal woman who has a background in successfully rolling out franchise operations in Rwanda. She is an inspiration to me. She one day can talk to the Minister of Health and the next day talk and negotiate with our partner banana farmers. I have a background in commercialization of healthcare products, specifically in the pharma biotech industry. And lastly, we have Ebenezer Fanta, who, if you can believe it, has a banana fiber textile and mechanical engineering background. And it's a better match than Match.com could do, I'm sure. And he's been working with us in transferring this pilot industrial scale manufacturing process, which we're all very excited about. And he's actually Ethiopian, so he's always asking me, when are we going to go to Ethiopia? We tag team with a really savvy group of board and advisors. We're very, very fortunate. We have, for example, the former Chief Innovation Officer of Kimberly-Clark, people who used to work in R&D at Procter & Gamble, and Kimberly-Clark as well. We have the co-founder of Seventh Generation on our board. Seventh Generation is one of the leading eco-friendly consumer product good company in the United States. They did it way back before it was cool. And like I said before, we have investment professionals and MIT, et cetera. We've been very fortunate as well to have a number of awards and recognition. Our first backer was Echo and Green, who made the leap. They looked at me like I was a little crazy, but then they got on board and they've been behind us ever since. Harvard Business School named me their first social entrepreneur fellow, and we've been recognized by Nick Kristof in a feature in the New York Times, Fast Company, and Bill Clinton himself held our launch pad very proudly. Thank goodness he didn't use it. Okay. In summary, this is really our business model. This is our model. We're instigators, and we create blueprints. And really our goal is to prove success in one country and to go to other places. So we start off with health education and advocacy. We instigate that. And as you've seen, we now can hand it off to the government, and they've taken over. We've instigated manufacturing and distribution. We're in the midst of this pilot industrial scale transfer. We're working with local entrepreneurs, and our aim is that local entrepreneurs will take this and run with it and grow the business over time so that's owned locally. So we can go off and go to other places and stamp our blueprint other places. Our financial request is $400,000 to support that global expansion, as I just explained. Another $100K to close the gap on the budget for this manufacturing demonstration. Now, as I said before, we're in Rwanda right now, operating for the past over 3 years. I've actually got over 300 individuals, entrepreneurs, governments, for example, the South African government, National University, Agricultural University in India, et cetera, inquiring, how can you bring this to my neck of the woods? And that is really our goal. It's a big problem. We need a big solution, and we hope to get there. Why, in closing, why am I not with my business school classmates on Wall Street? That's what my mom wants to know. Why do I do what I do? And it's really because the status quo is not good enough. And by you being here today, I think you agree. So I ask you to join me as we launch the launch pad globally. Thank you for your time.